Well, this morning we're going to talk about occupational therapy, speech therapy. We got some great guests joining us here this morning. We're going to start by having them introduce themselves this morning. Ashley, let's start with you.
Hi, I'm Ashley Ahrens. I'm the speech language pathologist from Titusville Area Hospital. I run the outpatient program and do inpatient services as well.
Very nice. It's been a little while since we've last talked to you, so it's great to see you back.
Yeah.
Thank you. Julia, introduce yourself.
Hi, my name is Julia Ferringer. I am the occupational therapist at Titusville Hospital. I also do all of the outpatient services as well as help with inpatient services.
Well, welcome to the program this morning. Well, we're going to start, just give us a little bit about your backgrounds. Where did you come from? How did you get to where you are now? Julia, we'll start with you.
Sure. So I went to college at Gannon University in Erie. So I did a 5-year master's program. And then after I graduated, I took my certification test in the middle of the pandemic and got hired at Titusville in December.
So if you can do it through a pandemic, you're good, right?
I'm good. I'm good.
So when did you know this was the field you wanted to get into?
So when I was in about 5th grade, my dad had physical therapy services. So that was always the track. Like I knew I wanted to do medicine, I wanted to do physical therapy, got into physical therapy at Gannon, wasn't quite my speed. And then I found occupational therapy, and it's a little more creative and it just clicked better. Nothing wrong with physical therapy, but occupational therapy fit my personality a little better.
So kind of describe that for folks who might not know the difference or maybe some of the details of what you do day to day.
Right. So both physical therapy and occupational therapy focus on rehabilitation, strengthening, exercises, and that kind of stuff. Occupational therapy takes it a little step further and makes it more functional. A lot of what occupational therapy does is function of daily activities. So making sure people can get dressed on their own, they can do handwriting, cooking, cleaning, and then in the kid aspect, it's even making sure that they can play, that they have a wide variety of foods that they eat, and they address sensory needs that go with picky eating.
So there's really a lot to it.
There's a lot to it.
I would imagine every day is a little different for you then.
Oh, for sure, for sure. In the outpatient especially, I might go from a workman's comp hand injury, and then in the next 30 minutes, I'm treating someone who doesn't like to eat fruit, and we're doing sensory activities with a 3-year-old.
Now I see why you brought her here. I don't mind fruit. I like fruit.
Okay.
So kind of talk about how the patient ends up in your care. What has to happen for that to take place?
To be in an outpatient service, you need to have a script sent over from your doctor. So if you're an adult, you might be post-stroke, or have Parkinson's, hand injuries, something a little more obvious that you might think of as an injury. And then your doctor will send you over, we do an evaluation, and then we treat that injury. For kids, it's the same way, but it might look a little different. You might have sensory needs or a diagnosis like autism, Down syndrome, and again, your doctor sends over a script, we do the evaluation, and then we make a plan from there.
So I would imagine the course of treatment would vary depending on the situation.
Oh, definitely.
Okay. Ashley, let's get caught up with you. It's been a little while. Tell us a little bit about yourself for those who may be meeting you for the first time.
Right. So I started back in Titusville in July of 2020, I think. So it's been a minute.
Yeah.
And when I first started, we did not have an outpatient speech program at all. So I've been working for about a year to build that program up, and then Julia came along. So that was a nice compliment to the speech program. So
not as a patient.
Not as a patient,
right,
as
okay.
an OT, right? So I've been working on building that outpatient program and some things that go along with that, and I've been busy on top of the hill.
How rewarding has that been, working on that for the past year?
It has been awesome. Having the creative freedom to kind of come in with a blank slate and figure out exactly how we want to attack it has been a really nice opportunity.
Where did you start? How did you kind of build up from?
We started at the very beginning.
Okay.
So the first day I showed up, I had nothing. I had no evals, I had no forms, nothing. I had to start at the very bottom and work my way up. And then, we talked about marketing and how are we going to market this program and let people know that we're here, let the pediatricians and the physicians know that we're accepting referrals. So it's been a process.
Yeah, is that like meeting with the doctors and trying to get staff on board to say, okay, this is what we can offer now?
Yep. So Kelly from our marketing program, I'm sure she was tired of seeing my face after the first 3 months because it seems like I was with her every day. We were, driving to local offices, meeting physicians, marketing our program.
So how much work goes into that? I mean, obviously it's a lot of work, but is it based off of what you know? Did you have to do any research in trying to build this up?
Well, no research in particular. I think the hard part was, taking on that marketing aspect, building the program, but then also being a good speech therapist, which is hard enough. That's a job in and of itself. So it was kind of a 2-for-1 when I took on the position. You're building the program, but you also have to do your actual job and do therapy and monitor those patients.
So kind of discuss the job part of it when you're working with patients, because I know you probably just love being able to work with a patient and help them get through their needs.
Right. So the thing about speech therapy and what drew me to speech therapy initially is I could work with an infant at 12 o'clock in the afternoon, and by 1 o'clock I'm working with someone who's 102. So it's just a huge span of clinical population. The people that we work with every day are different. I work a lot in pediatrics, specifically birth to 3. That was my specialty when I came to Titusville, so we've kind of geared the program to that, and I enjoy that therapy probably the most. Every kid is different, and it can be challenging.
I don't know if you saw the trailer. There's a big independent movie with Val Kilmer, because he was battling throat cancer, not able to talk, and just watching him struggle to communicate. And you sit back and you go, wow, speech is so important, and just using that to communicate with folks, it had to have been frustrating for him and for anybody that had any sort of throat or vocal issues. Is that rewarding for you when you see that breakthrough, when they're able to communicate?
Absolutely. So as a speech therapist, I think that communication is a human right. It's something that everyone should have the right to do. And for some people, it looks a little differently. We're going to communicate with verbal speech. That's how most people communicate. But for some people, that's not the best option, or it's not an option at all. So that's when, I come in, and my job is to decide what communication system or device is going to benefit you the most. And when that really kicks in and it works, it's the most rewarding thing.
So we asked Julia how she gets patients. How does it work for you? Is it
very similar process? You're going to need a script from a pediatrician if it's for a pediatric patient, and you're going to need a script from your PCP if you're an adult. And a lot of the same types of things: post-stroke, Parkinson's disease, ALS, a lot of the same conditions we're treating, just a different aspect.
So every day is different for you as well?
Absolutely, yeah.
And same sort of question, but the course of treatment and the therapy side just depends on the patient.
Yep, so therapy is going to be tailored to that person's individual needs and also their strengths and what they're good at. We're going to use that as a platform and base our therapy from that.
Is there a frustration sometimes among patients where they think, okay, well, this is how it should go. Here's the timeline of how it should be, but the reality is everybody's going to adapt differently to treatment?
Sure. I mean, you definitely see that frustration in adults who are seeking treatment themselves, but I think even more so we see it in parents of children who need speech therapy services. They bring you their child who's nonverbal or low verbal, and they say, how long is this going to take? A couple months and we'll be good? And it's like, no, that's not how this process works. Everybody learns differently. Everybody learns at a different pace, and it can take some time and persistence.
And I think sometimes, too, while things might look to be getting better in a situation, maybe you do stop treatment, or the parent takes the kid out of the program, and maybe there's a little bit of a relapse. And
absolutely,
they still have to work on that, don't they?
Yep, we see that a lot, especially in therapy in schools. So when kids come back from summer break, there's usually a certain amount of regression that you have to work through, because they're used to having therapy every week or twice a week, and then they go home on summer break and they get nothing. So outpatient services are a great way to kind of bridge that gap, especially over the summer months, to help maintain that progress.
Well, speaking of school, you guys have some screenings coming up that might help get that process going.
Yeah, we do. So we're currently offering free occupational and speech therapy screenings. It's the third Thursday of every month, and you can go online and register for that. We'll give you a time slot. You come in, we'll evaluate your kiddo and let you know if we recommend therapy services. And even if, you're not from the area and you're looking for services elsewhere, we're happy to give you those recommendations. But obviously we are offering those services at the hospital. And it's been a great program, and I think it's going to help a lot of kids.
That's great. Julia, back to you. Let's ask you this. When it comes to therapy, especially at home, working on just things at home, you don't necessarily have to go out and buy $2,000 worth of equipment to help you, right? There's things around the house you can find that will help with the treatment.
There are definitely things. In the aspect of pediatrics, working with the kids, their toys and everything they interact with day to day, that is the number one thing you want to be using, keeping it as natural as possible. And then on the adult side of it, if it's something for strengthening and you happen to have weights laying around the house, great. If not, cans of soup work, or we provide what's called TheraBand. So it's like a rubber band that's giant, and you just work on that instead of using a weight. But no, there's no additional cost for buying equipment when it comes to receiving OT services.
I think I get sneaky. We put all the cans when we go to the store in one bag, and then when we have the kids come out to help us carry the groceries into the house, we give them the heavy stuff.
Perfect.
Just work on that. You're watching The Morning Drill on Stream Television and on Armstrong's Neighborhood Channel, and listening to it on the Allegheny News Talk Sports Network. The occupational therapy screenings, what's that process like?
Because it's focused on the kids, we just have the kids come in and we just play with them. It's what they think we're doing, having them stack blocks and coloring, but really we're looking at those fine motor skills.
I can't even do that.
Well, you can come to our screening.
Okay.
We look at how they're holding their marker, how they're stacking their blocks, how they're interacting. Are they making eye contact? The beauty of pediatric OT and speech is you can hide the therapy within play. So the kids think they're having such a great time, but really we're working on those important milestones.
What are some key signals for parents that might make them think, okay, this is something we should probably have checked out?
So if your kid is only eating crunchy foods or only eating soft foods, only eating 3 foods, that could be an indicator of some sensory issues. If they absolutely hate getting messy and it's tantrums all the time, if they just touch the applesauce, that could also be sensory. And on the flip side, if they're always running into things and they like big movements and jumping off of things, that could be more sensory seeking. If they're not coloring and attending to typical toys, that can also be an indicator that something might be going on.
I am in so much trouble. Thanksgiving, I cannot let the gravy on my potatoes hit the turkey. I'm serious.
You need some sensory therapy.
Maybe. Ashley, on your side, what are some, I mean, there's probably some obvious things, but what are some things that maybe parents should be looking out for and thinking, okay, maybe we should have this checked?
Right. So obviously in our early pediatric years, we're looking for a number of words. Is your kid talking? Are they putting words together? Are they asking and answering questions? But more so, we look at social interaction as well. Are they making eye contact with you when you talk to them? Are they responding to their name? Are they playing appropriately? Do they have joint attention? Or are they attending to the same toy that you're attending to and kind of recognizing that we're both playing with this at the same time? You will never have appropriate language skills if you don't have appropriate play first. So that is one of the first things that I look at is, does this kid know how to play?
Is there any truth to a second or third child, just, where big brother or sister is talking for them? So maybe there isn't really an issue, but that's
Definitely.
a possibility? Okay.
We see that a lot. Older brother or sister does all the talking for them. And also, when you have more kids, you have less time. Life gets more hectic, so you spend less time reading books. You spend less time engaging in language-based play. It's just not the same with the second or third or fourth
And this is
kid.
on the parent side?
Yeah, absolutely.
Okay.
Yep.
So I shouldn't feel bad. Like, by the time our third kid rolled around, it was like, I give up.
You're going to have to be fine. You'll just figure it out.
But it kind of changes, doesn't it, where it's the older brothers or sisters that have sort of taken over some of that stuff, where they want to play with them or their friends.
Yeah, and it's also nice to have multiple kids to compare. So we see a lot of first-time parents say, I don't know what's normal because this is my first kid and I don't know what to expect. How many words should she be saying, or how should he be playing? I don't know. So it's nice to have, siblings to compare to, and that's when you really notice that difference in development sometimes.
Well, what are the screenings like for you guys then?
Like Julia said, it's a lot of play-based therapy and interaction. We're looking at those developmental skills inside play. So, can they attend to an activity for a certain amount of time? Are they imitating words? Are they making eye contact? So the kid has no idea that they're being evaluated. They think we're just playing with, blocks or bubbles or whatever it is. But really, we're looking at clinical development and looking for red flags.
How much has changed? Well, I'll ask both of you this, but how much has changed in this field over the last decade?
A lot has changed. We've learned a lot about development. One thing that sticks out in my mind about autism is that we've learned a lot about that.
Yeah.
We're much better at diagnosing it now. And so that is something that we're seeing more and more and more frequently. A lot of my caseload is made up of kiddos on the autism spectrum. So that's definitely something that Julia and I deal a lot with on a daily basis.
How about for you, Julia? A lot has changed over the last decade or so?
I would agree with that in similar aspects that Ashley said, and just learning from what has been done before, what works, what doesn't work, and adapting it to the modern age. So much has changed in society alone in the past decade.
And I would imagine there's probably, in terms of just working with folks, just differences now compared to even a couple years ago, and what they suggest to create a bond with your patient to make it more comfortable for them.
Right. Like iPads a few years ago probably wouldn't have been implemented into pediatric therapy, but now there's apps that mask handwriting skills and fine motor skills. It's definitely changed.
And it makes it kind of fun for them to continue with their treatment, isn't it?
Yes, and that's definitely key with kids, is finding the board games or computer games that they want to do, so they are improving those skills while they're still having fun, and therapy's not torture for them.
So we've been kind of talking about youth and then older adults a little bit, but sticking on youth for just a second, this is something, as the kids are going through this, the parents should take away some things that you guys are working, and I'm sure that you work with the parents as well, so that when they get home, or if they're doing it at home, to continue along those treatment lines.
Yeah, parent education is definitely a key in pediatric therapy. Typically the parents or whoever brings them does stay in the room, so they're picking up on how we're interacting with their kids, what we're doing, and something that seems so obvious to us, they might not think about because they have so many other things to be thinking about to care for their child. And it's making those suggestions and helping them find the resources that they don't have time to look up themselves.
I'm glad you brought up the apps. Ashley, I know a family that they rely on an iPad with some specialty apps, and it has really made a difference.
Yes, so AAC is augmentative and alternative communication, and that is something that I do offer through our program. And AAC is a huge umbrella term that we use. So sign language can be AAC, any type of communication that's not verbal. And for some kiddos, that is an app on an iPad. For some kids, it's a $10,000 specialty voice generating devices. And I've been able to obtain those too. So that brings a whole nother level of complication to the mix. And now we're talking about how we use this device and how we program this device and using that at home. But for some kids, it is life-changing, and it's exactly what they need. So we do that as well. And Julia knows it well. We do co-treat sessions, and so she's gotten very good at helping me facilitate their use during our co-treat sessions.
And I would even imagine for adults, the technology has played an important role as well.
Absolutely. For stroke patients, Parkinson's patients, these devices can be life-changing.
All right, let's recap. August 19th, what's going on?
Free screenings at Titusville Hospital, speech and OT. You don't need a script like you would for a typical evaluation. Okay. You just go online, pick your time, and show up.
But you do need an appointment, so...
You do need an appointment. Okay. That just helps us make sure we don't have people waiting around for their screening. So you just have to go online, pick the time that you like, and you get a free screening out of it.
Excellent. So you can call 814-827-1851, extension 3830, or go to titusvillehospital.org, and you can schedule a screening right there. Boy, that's kind of nice. That's convenient, having the ability just to schedule online.
Yep, schedule online. That's my extension. So if you call, you're going to get me. Wow. Fair warning.
Julie's like, she's going to call you all day just to see how you answer.
She calls me all day.
All
anyway.
day.
Yeah.
All day.
Direct
We joke
line.
about getting walkie-talkies.
Well, it's great having you guys on this morning. Thanks for your time. Thanks for all you do. And don't forget, that's the 19th of August. So schedule that screening today. It is absolutely free, and you get to meet these two. So be good, behave.
We'll do our best.
All right. Hey, thanks for joining us this morning.
Thank you.